Let me ask, so to really address this issue then, I believe your office created a shoppable care work group and tried to bring together some stakeholders. I think this was part of a broader effort, which you might want to talk about as well, but really to think about what should be done and what the Commonwealth might do to address this transparency gap and make this type of information available. So maybe could you talk about that initiative and put it in context and sort of not only why you decided to pursue it, but how you decided to bring stakeholders together to come up with some recommendations.
Yeah, so when Governor Wolf took office in 2014, I think he and those of us he brought to serve in his administration really understood that we need to do better in our healthcare system in many ways, and that to do better would require change and it would require innovation. So the governor asked the members of his cabinet that touch healthcare, including the insurance commissioner, which was my predecessor and then me, to develop a health innovation plan for Pennsylvania. And one of the critical pieces of that was looking at ways that we can try to bend the healthcare cost curve, the unsustainable growth in healthcare costs. And a piece of getting there, in addition to things like value-based payment and looking at innovation within healthcare delivery systems, was price and quality transparency. And so that encaptured a lot of important things. Health insurance literacy. How do consumers understand and engage in their health insurance, in buying it and in using it? It included talking about how we measure quality and making that information available. And then we brought together a work group led by Professor Martin Gaynor out of Carnegie Mellon to talk about shoppable care, right? That concept that we talked about earlier, where comparing a service based on price is not only viable, but truly the responsible thing to do as a consumer and on behalf of the healthcare system. So that was a multi-stakeholder group that included representatives from academia, from the provider community, the insurer community, and representing consumer organizations and patients to talk about how we do that. That work group has completed recommendations made to my department and really to the Commonwealth overall about steps that we could take to improve price and quality transparency and specifically shoppable care. Now those recommendations kind of take two tracks. One is, what can the Commonwealth do if we are successful in working with the Pennsylvania legislature to adopt what's called an all-payer claims database, or an APCD. An APCD is exactly what it sounds like. It's a database of all of the claims within a given region, in this case, the Commonwealth of Pennsylvania. So what services are paid for and how much is paid for them. Of course, that data is de-identified, so not at the patient level. That is in many ways the gold standard that state policymakers are using right now to provide widely available cost information. And the implications of what you can do with an APCD are much broader than that. They can assist with quality measurement, in adopting value-based payment models and structuring those models, in public health tracking and understanding utilization patterns and cost variation, and so many things. But we're also cognizant that that is a difficult conversation politically, and so it's not necessarily, it's not a foregone conclusion that we'll get there in working with our General Assembly and with input from many stakeholders on all sides of that. So we also asked the work group to say, what could we do if we don't have that? And we know that most health insurers make available today cost comparison tools to their enrollees. And there are advantages to that. For example, your insurance company knows things an all-payer claims database doesn't. They know exactly what your benefit package are. They know where you are in your plan accumulators, how much of your deductible have you already paid, or your maximum out-of-pocket costs. And they can, in a really well-done tool, integrate all of those things into the decision architecture that you will then it presents to you. So, but we saw presentations in that group of many of those tools. and some of them are significantly better than others, and I think all of them have improvement. And so the second set of recommendation is on how, first of all, we can improve those tools, but second of all, how can we further engage consumers in using them, because utilization levels are really quite low, even though those tools exist today.
What are some of the key arguments and maybe the merits of those arguments for why an APCD, really is not something that we should have in the state?
Yeah, I think the first is the cost, both of providing the data, but also the Commonwealth would need a source of funding to maintain that source going forward, and certainly to develop a truly usable, consumer-friendly tool that could be used to compare and navigate costs. And that cost comes from somewhere, and many states have chosen assessments on either insurance companies and or providers to fund that. That's a very viable concern. That's always a concern. And of course, at the end of the day, any of those costs, you're an economist, they're eventually translated back to the patient in one way or another. So that is something that we're concerned about. And we had a lot of discussion about ways that we could mitigate that and be creative. I think at the end of the day, what it comes down to more than that, although that is a very listened to argument by legislators, right, is those questions of competitiveness. And healthcare has always been this very opaque system. It's not like, people always say, it's not like going to the store and choosing which brand of milk to buy, because you don't have the information to make those decisions. But from any given stakeholder's perspective, they view either what they pay for care or what they are paid for care as proprietary, as confidential information, as their secret sauce that allows them to be competitive in the marketplace. And they are scared by what it means for their position in the market in making that information public. I think there's some merit to that, and in some ways I think it's a bridge we have to cross eventually, because consumers deserve and need this information, and because the evidence has really shown in places where this information is available, at least thus far, those anti-competitive impacts just haven't borne out in the way the fears say they might.
And you talk about competition, and we think about sort of antitrust enforcement and sort of information needed. Is there also a value from that perspective to have this type of data? And I guess maybe related to that, the National Association of peers like yourself, the National Association of Insurance Commissioners, is there general support for these types of things, APCDs, either for transparency purposes and or antitrust regulation purposes?
Yeah, I think there are a lot of applications that state regulators could use with this data. I think some regulators, frankly, have already been quite successful in using this data in states that have long had those databases and are using them creatively. They use them when they look at health insurance rates and decide whether the medical trend that an insurer is basing those rates on is correct. They've used them to enforce laws like the mental health parity law and compare the benefits being offered on the traditional medical side with those being offered on the mental and behavioral health side. And not only what the benefits are, but how those benefits are being used, because you have the claims data. I share the NAIC's fee committee that focuses on healthcare issues from that national perspective. And we've seen numerous presentations on not just how states could use all payer claims databases, but how they are, right? And so there's a lot of interest. I think it varies by state. For example, in most states, I think all but one that have all payer claims databases, they're not housed in the insurance department, and there's sometimes more cross-agency coordination than others. Sometimes the all payer claims databases are actually independent or governed by an independent board, And some of them, the data is more truly publicly available than others. So there's a lot of variation. And there have been recently some concerns, particularly there was a case decided by the Supreme Court in recent years that says that self-funded insurance models, which is about 30% of Americans are in those really large employer plans, those are exempt from state regulation. And the Supreme Court said those plans don't have to submit their claims data to these all-payer claims databases. And that's been tough. If you really want to understand, put your arms around the costs in your state, missing a third of the claims is not really a viable pathway, or you're missing something, right? And so states have, first of all, been successful in getting employers to voluntarily continue to submit that data and really keep that alive, but not always. And so that's also been a topic of discussion significantly, and how we can perhaps work with Congress and or the federal government to make sure that when we're having cost information, it's really comprehensive.